Examination of ulcer. On inspection, first note the size and shape of the ulcer and measure the size in centimeters in 2 dimensions with a measuring tape. Then note the number, whether it is a single ulcer or are there similar ulcers elsewhere on the body. Now note the exact anatomical location of the ulcer. Many ulcers have a characteristic site where they occur. For example, a varicose ulcer is located on the medial aspect of the lower third of the leg. Rodent ulcers are confined to an area of the face above the line joining the angle of the mouth to the ear lobule. Tuberculous ulcers are common in the neck over the sites of tuberculous lymphadenopathy. An ulcer on a weight-bearing area is usually a trophic or neuropathic ulcer. For example, over the heels as seen in this patient, or over the sacrum and other bony points in a bedridden patient. And arterial or ischemic ulcers occur over the dorsum of the foot and the toes. Next, inspect the margin and the edge of the ulcer. Margin is the skin border or transitional zone of skin around the ulcer. That is, it is the line demarcating the ulcer from the intact skin. There are 3 types of margin. A healing ulcer shows a typical bluish line of growing epithelium, which is squamous epithelium without cornification, hence looks bluish. Inside this line is the red granulation tissue covered by a single layer of epithelium, which is transparent and shows the red color of the underlying granulations. And outside is the white zone of newly cornified epithelium. So, the margin of a healing ulcer shows 3 lines, outer white, then blue and inner red. A spreading ulcer shows a red, inflamed and irregular margin with inflamed surrounding skin. A chronic non-healing ulcer shows marked fibrosis with thickened white skin margins without the blue line of growing epithelium. Edge is the mode of union between the floor and the margin of the ulcer. So it has thickness, a 3rd dimension, and it can be inspected as well as palpated.